Good evening, everyone. I am Soumya Kumar, a third year mbbs student from SSMC Medical College, Rewa. So, this will be my second video of medicine, and this will be about heart sounds. So, let's start. So, we know that there are four heart sounds: S1, S2, S3, and S4. Now, S1 and S2 are always physiological. S3 heart sound can be physiological or pathological, and S4 heart sound is always pathological. We know that opening of valve will produce no sound, while the closing of valve will produce a sound. Opening of valves can produce a sound if the valve is calcified, has calcium deposits. Now, to understand the heart sounds, we must know about the valves. So basically the heart has four valves: the mitral valve, the aortic valve, the pulmonary valve, and the tricuspid valve. So, what is the significance of these valves? Now, the mitral valve, it is the bicuspid valve. It is actually the valve between the left atrium, which you can see here, and the left ventricle. Now, similarly, we have the tricuspid valve. It is between the right atrium and the right ventricle, like you can see as a corresponding valve for the mitral valve in the right side. Similarly, we have the pulmonary valve, which is between the right ventricle and the pulmonary artery, and the and the aortic valve, which lies between the left ventricle and the aorta. Suppose these are two flaps of a valve. So now these are they are in open state. Now when they will close, they will produce a sound like you can hear a small amount of sound. But when they open, they will be not producing any sound. But when they close, they produce a sound. So we will start with the S1 sound. Like you know that blood in a normal cardiac cycle, blood will go from the atrium to the ventricle and so on, and then the aorta if we see the left side, and the atrium to the ventricle, and then to the pulmonary artery if we see the right side. So that is why the valve which comes into motion first will be the mitral valve or the tricuspid valve. So this is why S1 sound is because of the closure of the mitral or tricuspid valve. Now the closure of mitral valve produces M1 sound, tricuspid valve closure produces a T1 sound. Now these both closures are actually simultaneous. So you will observe that both of these sounds are having no difference in time. So there is no split between the M1 and T1 sounds. But this is not the case in S2, because in S2 the pulmonary valve closes a little later. Like S2 sound is basically due to the closure of pulmonary valve and the aortic valve. So A2 and P2 basically. But you will see that the pulmonary valve closes after the aortic valve, and this will produce an S2 split. Now physiologically, S2 split happens in inspiration. Now why? So basically in inspiration, as we inhale air, so as for the air to go in, the volume must increase and the pressure must decrease, because we know that air goes from a high pressure area to low pressure area. So that is why the intrathoracic area will increase due to the increase of the intrathoracic volume. So due to the increase of intrathoracic volume, the pressure will decrease. Now you must have studied PV is equal to nRT or PV is equal to constant in the 11th or 12th class. So based on that, pressure will decrease. Now due to this, the venous blood will enter into the right half. Like due to the change in volume and pressure, the venous blood will go to the right side so as to compensate for the loss of volume. Now this will cause a delay in the closure of the pulmonary valve due to extra blood that is coming in, and this will cause a S2 split, as aortic valve will close before the pulmonary valve. So this is a physiological process, but pathologically S2 split can also be seen. So S2 split can be paradoxical. Now what do we mean by paradoxical? Paradoxical means opposite, like kind of opposite. So here the pulmonary valve will close before the aortic valve, like this happens in aortic stenosis. What is aortic stenosis? Aortic stenosis is a condition in which there is the opening which is caused by the valve becomes narrow. So that is why there is a decrease in the blood that flows inward. Now we have fixed split and wide split. So what is wide split? There is an increase in the splitting between the A2 and the P2 in the S2, like A2 and P2 sounds of S2. So this happens in pulmonary stenosis. Now what is pulmonary stenosis? So the closure, the opening that is found between by the pulmonary valve will be narrow in area, that is the pulmonary stenosis. Similarly, fixed split will happen in atrial septal defects. Now we go to S3. As we discussed, S3 can be pathological or physiological. Now when is it physiological? It can be physiological like in cases of a normal child, a pregnant woman or an adult. And when is it pathological? By the way, S3 is a early diastolic sound. It happens due to the jet of blood that strikes against the ventricle wall during diastole. Now pathologically, S3 can happen in dilated cardiomyopathy and systolic heart failure. So S4 is basically the opposite of S3 because S4 happens in diastolic heart failure. Like S3 happens in systolic heart failure, so S4 will happen in diastolic heart failure, and similarly S4 will also happen in hypertrophic cardiomyopathy. Like you can see, S4 is kind of opposite of S3. It is a late diastolic sound, whereas S3 was early diastolic sound, and S4 is always pathological. Now one thing that can be used to, like we read about the pathological S2 split, the paradoxical one. So how can you remember that aortic stenosis causes paradoxical split? Like I have remembered it as see, S2 का split हुआ, तो S2 याद रखना है, एक मिनट, S2 का split हुआ तो S2 याद रखना है, aortic stenosis, so A यहाँ पे और S यहाँ पे, और पैराडॉक्सिकल है तो PA, तो इसे ऐसे याद कर सकते हो, इट बिकम्स S2 AS mainly for aortic stenosis and PAS which is mainly for paradoxical. So this was my second video on medicine. You can like if you want, like if you like the video, and tomorrow actually it is night now, so good night, and tomorrow is Holi, so happy Holi to everybody.